Our Ganey project is a partnership between our students and a local pediatric clinic, as well as the patient community. When a clinician sees a rare disease, they often may not have seen it before, even though they've been in practice for many years. For instance, the clinic we worked with, the year we started, they had seen 25 rare disease cases, but only one case per disease. So our students worked with the Michiana Health Information Network, who have 80,000 rare disease records of local rare diseases, and they were able to obtain between 10 and 50 cases per disease, and we provide that information to the clinicians so that they have the proper clinical context, which really moves diagnosis and treatment and management of the diseases along much, much more rapidly.
My name is Nicole Sevison. This is my daughter Skylar. A couple years ago we were approached by our pediatrician Dr. Reed, who happened to be friends with Barb, about sharing Skylar's story with the Rare Disease Club. From there, we were approached about a case study. Skylar has neurofibromatosis type 1, and she presented with a rare case of pseudoarthrosis in her tibia and fibula. So we collaborated together on a case study about Skylar.
As a nurse practitioner and patient outreach coordinator for the Center for Rare and Neglected Diseases, the goal for the Ganey Project was to partner students with patient families in the community, and also to assist the healthcare providers with diagnosing and treating rare diseases. And as part of having Skylar, we identified one rare disease which actually had a different presentation. And those different presentations can be brought out when we compare records from the Michiana Health Information Network with patients that we see in the community. So that information is gathered by the students as well as myself, and we provide that information to the pediatricians so that they can better understand rare diseases in the community and they're better able to follow the progression of the disease.
As a student, my involvement with the rare diseases began 3 years ago when I started working with Dr. Halder in her class, and from there I was exposed to patient families like the Sevisons, as well as other projects such as the Ganey Project, where we get to work with community outreach coordinators as well as physicians and research to really all bring it together. And one manifestation of this was this case study that we were able to publish. And it's through efforts like this that we really get to reflect Notre Dame's values for helping serve the community, and this project's been a great exposure to that.
We want to work with the community because rare disease patients often know far more about the disease because they live with the disease every day. A clinician may see a rare disease very infrequently, so the patient is a very important source of information and collaboration. And our students also work with patient families directly in presenting posters and talks about the diseases that they research with the community. In the case of Skylar's case, it actually turned out to be a very special presentation of NF1, and what the case report suggests is that federal guidelines for the diagnosis of NF1 need to be modified. So this has implications for disease in general. And this is actually what makes it very important to the health of our communities.